Hi everyone, my name is Olivia. I am a graduate student at Delaware Valley University, and today's presentation is about utilizing structured playgroups for children with autism. To give a brief overview of our slideshow presentation today, we will first review some basic characteristics of individuals with autism spectrum disorder, also referred to as ASD. We will chat about what this diagnosis might look like, along with some of the challenges that are important to keep in mind while working with individuals who have ASD. I will be defining and discussing the basics of structured playgroups. We will discuss what is structured playgroups, what are the goals of using structured playgroups, how can using one help individuals with ASD, how are they currently being implemented in practice. Together we will learn to establish a foundation for the use of structured playgroups while also learning the specifics on how to put into use and actually facilitate group play. Along the way, we will also be discussing appropriate methods to monitor progress and to ensure that our efforts are benefiting our clientele. So, starting out with a diagnosis of autism spectrum disorder, ASD is known as a developmental disability that affects the way the brain functions. The most current diagnostic and statistical manual of mental health disorders, the DSM-5, describes it as a persistent deficit in social communication and interaction across multiple contexts, along with restrictive and repetitive patterns of behavior, interest, or activities. As we break that down a little further, we will look at the social communication and interaction challenges of individuals with ASD. These challenges include social emotional reciprocities. So that could be the failure to carry a back and forth conversation with someone or the inability to initiate or respond to social interactions. This also could be displayed in difficulty expressing nonverbal communication behaviors, so such as displaying unusual eye contact or the lack of facial expressions, along with the inability to understand other people's body language. So a lot of times individuals with autism struggle to make connections between someone's facial expression and body language and what emotion they may be feeling. Another challenge may include a deficit in developing, maintaining, and understanding relationships. That could include difficulties in adjusting behaviors to suit various contexts. So an example of that might be you behave differently when in a public setting than you may in your own home or with close friends. Someone with autism may not understand the differences of how you behave in certain situations. There may be difficulties in sharing imaginative play or making friends, and it's also important to keep in mind that this may include individuals who may not present an interest in socialization or those who just may not choose to do so. Restricted and repetitive patterns of behavior are another aspect of ASD diagnosis. So repetitive motor movements are very common among the population. They're often referred to as stimming. So these repetitive motor movements, or stimming, are also seen in neurotypical individuals, and they are viewed often as coping mechanisms. Some of the stimming behaviors that I'm talking about may include flapping one's hands around, fidgeting with other objects, rocking back and forth in a chair, or repeating the same word or phrase over and over. Other common behaviors may include insistence on sameness and inflexibility adherence to routines or rituals. So these two things often go together. Say maybe an individual with autism likes to follow a specific morning routine. They may eat the same thing for breakfast every single day. On days when they cannot eat the same thing for breakfast, this routine or ritual is broken. It may affect their behavior. They may not know how to cope with that. Another challenge related to routine may be experiencing difficulties in moments of transition, not knowing how to transition from one task to another. In regards to restrictive aspects of this, individuals with ASD have fixated interests that may be at an abnormal intensity or focus. They can cause strong preoccupations or attachments with specific interests, hobbies, and even sometimes objects. It is very common with individuals with ASD to use their fixated interest as a buffer in their social lives. So you may find that they often use these interests to guide conversations or relate to their own experiences. Another characteristic that seems important to mention is a difference in sensory input for individuals with ASD. individuals may experience hypo or hyperreactivity to sensory input. Examples of this may be that they have an adverse response to specific sounds. They can get very overstimulated with loud noises. They may be super sensitive to certain textures and the way that things physically feel against their body. These individuals also may have intense interest in sensory aspects of an environment that may seem unusual based on societal norms. So this may include the action of excessively smelling a specific object or excessively touching something. It also could be a visual fascination with room lighting or fixtures. These are all really important factors to keep in mind when working with individuals of this population, specifically the sensory input part, when creating an environment that you want to work with individuals. With ASD, you want to be mindful that you're not going to be triggering some of this reactivity. This quote by Dr. Stephen Shore reads, "If you've met one person with autism, you've met one person with autism." This quote truly emphasizes that there is great diversity within the autism spectrum. Although there is commonality in some of the characteristics that may be displayed within this diagnosis, there are still differences within communication, social interaction, and focused interest. Although we just reviewed some of the common characteristics found in an autism spectrum disorder diagnosis, when working with adolescents in the population, understanding that their diagnosis looks different than other individuals' diagnosis is super important. Now discussing specifics of structured playgroups, abbreviated SPG. Learners with ASD often struggle with social interactions and integrated play. Structured groups can be used to address social skills such as initiating interactions and developing play skills, and a broad range of other skills and behaviors. SPG groups are characterized as a small, predetermined group of students. These individuals meet consistently across time to engage in structured routine and define play activities within a defined space. Consistency and structure are a vital aspect of this type of practice because individuals with ASD often strive off of routine. This play is facilitated by adults who, through clear roles, use evidence-based practices such as prompting and reinforcing to support the target learner with ASD's use of skills and behaviors during playtime. These groups include children with ASD, along with children who are typically developing. This is a super important factor of SPG groups because it allows individuals on the spectrum to have social interactions with individuals who are typically developing and may have more advanced learning and social skills. A common concept when working with groups is that having individuals who have more advanced skill sets than you will help you enhance your skill set and allow you to be pushed to gain better experience. Good peers for an SPG would have appropriate social skills, higher communication and language skills than a learner with ASD. They would hopefully have positive interaction history with students with ASD and are willing to comply with suggestions from adults in structured play to make the experience successful. So, structured playgroups can cater to a large variety of goals. These goals can include increased specific skills or behaviors along with decreasing other ones. Examples of some of the goals seen in structured playgroups include increasing social skills and social interactions, increasing the ability to have peer-directed commenting, so just having overall more opportunity to communicate with peers, helping promote language diversity, communicating skills, and replacing isolated and stereotyped object play with increased positive play behaviors. Structured play groups may also have goals of decreasing maladaptive behaviors when interacting with others in a mutual play space. So this could be decreasing negative behaviors and maybe learning to share with others or learning to communicate in more beneficial ways. Structured play groups have been shown to be effective interventions for young learners with autism, and it's considered an evidence-based practice. They are flexible in where and how they can be implemented, so learners with autism who have participated in structured play groups before have generalized these skills to other settings, which is a long-term goal. The first step of implementing playgroup is establishing a foundation. Resources needed to develop such groups include consistent space to play on a consistent basis, a small group of students who are typically developing, toys and other materials specific to the activities the group will be completing, and consistent adults to facilitate the group. Again, really emphasizing this concept of consistency to assure that these methods are being implemented for success. When arranging the play space, consider the location of the space within the room. The space should be away from distractions such as windows or noisy areas in the room. As I mentioned previously, a common characteristic of individuals with ASD is that they may be hyperreactive to their environments. So creating a safe and comfortable space is super important. Spaces should have good visual boundaries and visual supports that assist the learner with ASD and their typical peers to understand the location of the play materials and the play routine. The length and frequency and the duration of structured play groups may depend on the age and the development of the learner with ASD, but typically we would say 30 to 60 minutes would be an ideal session. Typically, structured groups would meet 2 times a week for a minimum of about 3 months. After 3 months, the group can then be reevaluated and reconfigured if necessary. Structured play groups can be used by a variety of professionals, including teachers, special educators, therapists, and early interventionists. It may be implemented in education and community-based environments, and also parents and family members can use them in their home as well. We don't often see success as much in the home environment, and I'm only saying this because sometimes we may not have access to the peer support that would be in the group, or some of the materials or the environments that would be necessary to implement groups like this. But if all of those materials and all the other needs that we have talked about already are met within the home system, then this definitely could be implemented there as well. When using structured playgroups, you must identify the behavior you want to work on. So first, a baseline would be collected through observation. Then once the baseline is complete, you would establish a goal or an outcome that clearly states when the behavior will occur, what the target skill is, and how the team will know when that skill is mastered. When creating a plan of what the structured play would be, you would generally pick something that the child would be interested in. What we know about children in general is that they are more inclined to participate in behavior that benefits them in some way. So when identifying what skill or behavior can be addressed through structured play, consider skills that are appropriate. Skills that the learner with ASD would have multiple opportunities practicing in group setting, and one that requires social interaction and communication would also be an aspect to consider. Once we begin to identify the target skills, we would then begin to identify and select the roles for the structured play groups. So we would identify all the possible tasks that are relevant to the selected activity. Next, we would then develop roles for each of these tasks, including both the beginner roles and expert roles, so that each learner with ASD and their peers have an opportunity to feel successful and to feel challenged in their role. If the play scheme is cooking, for instance, cooking and serving, some of the roles that the individuals may have may be a kitchen helper, a cook, the table setter, a server, a dishwasher, and so on. Once the target skill or behavior is established and roles are created for each peer, we would want to establish a routine and rules for the structured groups. So creating written and visual rules and schedules can be really beneficial for individuals in this type of setting. Groups would start with discussing the group rules. These rules could include things like feet stay on the ground, clean up and put things back where they belong, ask before you take, wait your turn, or use nice or polite words. Basically, anything that seems applicable to the group and to the target behaviors of the group can be used. During this time, it is important to determine the supports needed in the specific routine for both the typical learners and those with ASD. All group members may struggle when they're learning something new. This is true with ASD and typical developing peers. So, if one facilitator is not able to observe the whole group's dynamics and address the individual learning needs of each student, more facilitators may be needed. During this time, it would also be important to consider the support each student may need by talking to the caregiver of each learner to gather more information prior to the start of the group. So this information could include the learner's previous experience in play groups, types of activities that the learner enjoys, types of activities that they dislike, their strengths while interacting with others, some challenges that may come up when interacting or playing with others, what works if or what doesn't work if they become upset or frustrated during activities. And then next, it would be important to provide orientation to all the learners, of course, using appropriate developmental levels. So we may explain what is the purpose of this structured play group. We also may want to talk about what is expected in the playgroup, so we could give them information about the sequence of events. We could provide them with visual schedules and of activities to support everyone's understanding of the routine. We may talk about what are the ways that this group can help everyone in play, so we can provide more of an orientation for the typical developing peer that we want them to help us help support the learners with ASD. So give an example of an opening routine that would be created for a structured group play. So we may greet each learner as they arrive and model for learners how to greet one another. Then we could transition into the group space, whether it be sitting on the rug in a circle or sitting around a table or a desk. We would review who's in that group today, review the schedule for the day, and discuss the play scheme. Then we would begin to prepare them for the play scheme by having conversations about it, potentially offering visual supports or stories to explain what that topic or experience may look like. Then discuss each learner's role, giving specifics of what their task entails and how they can all work together. Rules would then be reviewed, including the created visuals and schedules for play. We would then begin our structured play. Throughout structured group play, practitioners should be guiding participation by nurturing play interactions. So one may use guided participation to support their learners with their focus on play activities through verbal narration. So while individuals are performing play behaviors, you could narrate the actions that you see to guide the individuals with ASD with processing the play behaviors that are taking place and that they're seeing happening. Practitioners can also nurture the learners to maintain play and interaction by using prompting, suggesting language to use, modeling behaviors, and utilizing reinforcement during playtime. Something that is important to consider is expanding limiting roles in the play setting. So if an individual has only played the role in a play scheme, like one specific role, then the adult might want to expand on the role by modeling new behaviors acceptable for the play setting, so this can help expand their play experience. The use of social stories in the setting can also assist individuals with ASD to interpret nonverbal and verbal cues, as well as help them gain and maintain the attention of others in the group while playing. After using prompting and guiding participation, we must fade adult supports for all types of individual learners. We must gradually shift the adult supports of the learner with ASD and typically developing peers within the play scheme. Strategies of this may include developing a least to most prompting hierarchy for each individual learner and fading the prompt slowly over time. Not only can we do this by fading the prompting and verbal cues, but by also moving the adult physically further away from the structured play group and play space, and then only having them re-enter when it's necessary. We can assist the fading process by developing individualized visual supports to assist the learner to independently play, so like creating a visual social script or a routine script. We can also diminish our supports by using an intermittent reinforcement schedule. So, this would provide the learners with ASD with reinforcement for some, but not all of the target behaviors or skills, so that we can begin this feeding process. So, plan to collect data on the learner's performance of the target skill throughout the implementation of structured playgroup. You can collect data every session or every other session, or only once a week, depending on the type of behavior that's happening, or whether it's a high priority, or depending on how often the group's meeting. Behaviors can then be tracked, including asking for help with appropriate skills rather than screaming, greeting others, the length of time playing with peers. So there are different types of data collection which can be used. So one is event sampling and another is duration collection. So event sampling would be like tallying every time the student appropriately asks for help during playtime. Duration collection would then be documenting the duration, so the start and end time of each time a student may engage in a behavior like engaging in parallel play during playtime. Once the data is collected, we then can determine the next steps based on the learner's progress. When monitoring the learner, it's important to observe and record any differences that occur in the performance of the behavior of the skill. So, is the learner making progress towards achieving their behavior? Does the level of progress remain the same? Are they or are they not making progress after 3 sessions? Then we can consider, maybe, is the target behavior well defined? Is the target behavior measurable and observable? Does the learner have sufficient opportunity to practice these skills during the playgroup? Is prompting and reinforcing used to encourage the learner of this behavior or skill? Are routines and activities of the structured playgroup implemented consistently? If the target behavior or skill is not being met, that signals that you may need to reassess and adapt new goals, or maybe potentially just enhance prompting or something. And that concludes today's presentation on utilizing structured playgroups and the benefits they have for young children with autism. I encourage you to continue to explore the research on this topic and the many other treatment plans and resources available for working with individuals within the ASD community.